We're joined today by Dr. Lyndon Haviland. How are you today?
I'm great, except the polar vortex is kind of bumming me out,
Oh
I have
yeah,
to say.
it's a little bit cold. We're not used to that here in New Orleans, but you know,
No.
we're really glad that you're here.
Well, we feel the warm welcome, even though the air is cold.
Oh yeah, exactly. So, I mean, you're doing a lot of stuff with the conference, and I just wanted to ask, you see public health funding is being cut.
Yes.
Where are some of the biggest funding cuts, and what are the ramifications of those cuts?
I think the ramifications of the cuts, both domestically and globally, are that we don't have a functioning public health system. I think the Ebola crisis in West Africa and then the misinformation about it here in America demonstrates that the world would be a better place if we had a fully functioning public health system. And that would mean that we actually had trained personnel, strategic communications, and the ability to do both prevention and care. Public health is about prevention, and it's not about medical care, and I think there's a big misunderstanding about that.
Yeah, I agree with that. What are some of the biggest trends in public health funding right now?
Well, one of the biggest trends that we see is that despite the fact that public health systems, the funding has been cut, we see a huge amount of interest in young people. It's one of the fastest growing undergraduate degrees, and it's one of the areas where we see people getting excited about building the healthiest generation, about building a healthy nation, and people understand very clearly the link between good health and economic development, both here and worldwide.
Now, those are encouraging words. What are some of the other encouraging things that you've seen in the trends?
Well, one of the most encouraging things I always see when I come to APHA is I see the student assembly and I see young people who are thrilled to learn about the wide range of topics that they could get excited about and be a part of in all of global health. So I think that's exciting. I think the other thing that's exciting is there's really a acknowledgement that we can't solve disease problems in silos, that we need to look about systems. So to me, using information, data, and understanding the role of the built environment in building healthy communities.
Well, I'll tell you what, there are so many people at this meeting. What can the public health advocate, the grassroots guy, what can that person do to really push public health in America?
Well, here in New Orleans, the first thing they could do is come out and support the idea that New Orleans should be a smoke-free city. You know, APHA won't be coming back to New Orleans until New Orleans is smoke-free. So tobacco remains the leading cause of preventable death and disease in the United States. So the first and most important thing is support New Orleans in becoming smoke-free. The second is really to talk to your lawmakers and talk to people about the importance of building healthy communities, communities where people can walk on the street, they can exercise out of doors, and lead by example, frankly. Get out there and exercise, make healthy food choices, and really talk about the need to be healthy.
Well, those are really great things to do, and we're pushing for that here in New Orleans, let me tell you. All right, thank you very much, and have a great conference.
My pleasure. Thank you for making a warm welcome for all of us here in New Orleans.
Thank you.